तो मैं कर रहा हूँ वर्ल्ड इंकॉन्टिनेंस पे चल रहा है.
Good evening, everybody. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. OAB is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence-related issues and its impact in the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of OAB, today we have with us renowned Dr. Anil Elhence. Dr. Anil is president of North Zolan Chapter, Urological Society of India, Chief Urology Consultant and Medical Director at Dhanvantri Hospital, Sake, Meerut. Dr. Anil Elhence has 29 years of rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very good evening to you, Dr. Elhence. It's a pleasure to have you with us, sir.
Good evening and nice to be here on your show.
Doctor, as we are celebrating World Continence Week, first of all, I would like to know what World Continence Week is all about. Why do we celebrate it?
The reason that this week is celebrated is basically because incontinence is a stigma, is a social stigma in the sense that people who suffer from it feel that they are unfortunate and they are destined to suffer from it and do not seek help. So by increasing awareness about incontinence and giving them the option that they can lead a normal, healthy life and be dry, so this is to create awareness so that people don't remain shy and seek help. And that is the basic concept of celebrating this week, so that anyone who's listening to this program, and there are various programs being done on this World Incontinence Week, is basically to increase awareness and to get those people who suffer from this condition to seek help.
Right. So the whole idea behind it is to let's talk about it. Let's spread some awareness on it. And doctor, as today we are going to talk about overactive bladder, OAB. Please elaborate that for our viewers.
As the English word overactive means, the bladder is acting much more than it is required. Normally what happens, our kidneys are constantly producing urine, and this urine is stored in the urinary bladder. An average adult would have a bladder capacity of around 300 to 350 ml, and this bladder gradually keeps filling till that level. Once our bladder is full, the bladder sends sensation to the brain that I'm full and I need to be evacuated. And the male or the female, whosoever is, goes to a socially acceptable place, a place where they have privacy, where they are able to ease themselves and let go of the urine which is stored. And the bladder is emptied out, and then for the next 3-4 hours, again, the bladder fills up to that capacity. What happens in OAB is that the bladder gives sensations to the brain much earlier than the 300-350 ml capacity is reached. So a patient or a person can have this sensation of a very strong desire to pass urine at much lower volumes. So the patient has to go more frequently. If I take 4 hours to make 300 ml urine, I'll take probably 1 hour to make 50 or 100 ml of urine. So at 50-100 ml, my brain is getting signals I've got a strong urge, so I have to go more frequently. Then this contraction which the bladder undergoes is a very strong contraction, and the person, male or female, is unable to hold on to the urine and can have a wet OAB also, which means that involuntary leakage of urine. So the patient will have increased frequency, going more often because the urge is there at lower volumes. The urge is very strong, so the person is unable to hold on to his bladder and has to rush to the toilet, and at times even leak some amount of urine. So this is the spectrum of disease which OAB is all about.
Right. So that's how we, understand OAB or overactive bladder. And are these the only symptoms, doctor, or there are other major symptoms of OAB as well?
The basic symptoms of OAB are these three: increased frequency. If this frequency is also at night, it is called a nocturia, but frequency is diurnal. It will be remaining across 24 hours. So it will be daytime as well as nighttime increased frequency. Urgency is when once you have the urge to pass urine, difficult to hold on. And precipitancy or leakage is when when the person is unable to hold and some amount of urine gets leaked out. Associated with this can be, there are again, OAB can be of two types. One is a primary OAB where there is inherent disease of the bladder, and others where there is an associated abnormality with the bladder. Like if there is infection in the bladder, which will also cause some degree of OAB, but then the infection will also cause some amount of burning or dysuria as it is known while passing urine. And also the infection could lead to fever. So these are associated fevers that primarily OAB will cause those three symptoms which I talked about. The other symptoms are because of the associated conditions. Like someone has got a neurogenic problem, there is a problem in his spine or the nerve supply, he's got a brain hemorrhage, brain stroke. So there'll be problems associated with the brain stroke or brain hemorrhage or the spinal deformity. But the OAB symptoms per se would be those three which I had mentioned.
Right. And what causes overactive bladder, doctor?
OAB, as I said, is of two types. One would be the primary, where inherently the nerve supply coming from the bladder going to the brain is affected, and it gives signals prior to the critical point where those signals have to be given. So it is a afferent. Afferent is the supply from the bladder to the brain, which gets activated, and then it activates the other arm of the nerve supply, which is the efferent. So the brain gives a signal to the bladder to evacuate. So the bladder will contract. So this is more of a nerve supply issue related, which can be because of either delay in maturity of those nerves, if it is seen in a young person, or demyelination of the nerves have got damage over a period of time because of wear and tear, that this can occur. Also, it can occur because of a certain myogenic. The bladder also has got muscles. So if the muscles are also stretched for blood and there is a little lack of blood supply to the muscles, they also get a little irritated or irritant. And so with a little stimuli, they also produce a similar kind of symptoms. So this is the primary OAB, which can be because of myogenic or neurogenic factors. And then we have secondary factors like a stone in the bladder, infection of the urinary bladder, prostate enlargement in males. So these are associated conditions which can also give rise to irritation of the bladder, and like a stone will irritate the lining of the bladder and cause OAB symptoms, or the infection will irritate the lining of the urinary bladder and cause these symptoms.
Right. And doctor, whenever we talk of a problem, we know that a solution is also available. So what are the treatment options for OAB?
The treatment options, prior to jumping to treatment, we have to make sure that the patient has got OAB per se, which means incontinence or leakage of urine, as we are in the incontinence week, can be because of certain other conditions. OAB is not the only conditions which cause incontinence. So we have to be sure that this incontinence is because of OAB and is not because of other conditions. There is a condition known as stress incontinence, more frequently seen in women, where whenever a woman strains at she has a loud cough or laughs loudly or strains at anything, there'll be an involuntary leakage of urine. In men also it can occur, but more commonly seen is known as stress incontinence. Then there is an overflow incontinence seen more commonly in men, where the bladder is over distended and then it spills when it cannot hold any more urine, then it just trickles over. It's like a pot which is full of water, and then as you keep filling it will flow over. So we have to make sure that the patient doesn't have either stress or overflow incontinence and has got urge incontinence. And in urge incontinence, you have to rule out all these secondary problems like a tumor in the bladder, stone in the bladder, infection in the bladder. And then if we have obviously those conditions are there, the stone is there, a tumor is there, infection is there, we need to treat it, and mostly the OAB symptoms get treated on its own. Now we come to treatment of OAB where there are no secondary factors and it is a primary OAB. Then is your question where it was that how do we treat primary or OAB per se? The first thing is lifestyle changes which are mandatory. And in lifestyle changes, there are few things which need to be done. A person who is producing or having to go to the toilet very often has to reduce the fluid intake. It's a heritage in India that for any problem related to urine, we say drink lots of fluid, as if it will flush and clean the system. But in OAB, it is counterproductive. So we have to reduce the amount of fluid that the person is consuming and has to consume as less fluids as possible. Obviously, the person will have to be off alcoholic drinks because that increases the urine production. Has to be off caffeine, tea, coffee, chocolate, which also increase the urine production. Has to be off acidic fluids. A typical acidic fluid is orange, citrus fruits, orange, pineapple, even tomatoes are acidic. So avoid these fruits and vegetables while if you are suffering from OAB. Spicy food has to be avoided, and all fizzy drinks, Cokes, all the drinks having fizz, they have carbon dioxide. The carbon dioxide also irritates the bladder. So these are the 6 things which you can do in our behavioral lifestyle changes, which will help reduce the OAB symptoms. Apart from that, of course, lose weight, be physically active, and if you have got diabetes or any other problem, that has to be corrected. If these factors do not work, then we get on to the medical treatment, and we have got very competent or very effective drugs now. There are 2 basically group of drugs known as anticholinergics and beta-3 agonist, which can ameliorate these symptoms very, very significantly. There are certain side effects associated with these drugs. So you have to balance these side effects with the positive effects we have. And these patients, most of them do well with these drugs. And subsequently, also, if I take the treatment further, there'll be a certain subset of patients which do not respond very well to these drugs. Then we can use a combination of drugs, increase the dose of drugs, and then we've got certain procedures like injecting a particular agent in the bladder or even resorting to surgery. Certain biofeedback mechanisms are also available to treat. So it's a wide spectrum of treatment options, starting from lifestyle changes, medications, and of course, intervention also.
Right. So the basic mantra is stay healthy, have a good, healthy lifestyle, eat healthy, work it out, and stay stress-free, have your own
me time. That is true for just about everything. Yeah, that is true for just about everything.
Actually, that's true. And doctor, what should a patient do if he or she thinks of having, these symptoms? What's the first thing they need to do?
If a patient has these symptoms of increased frequency, difficult to hold, and or leaking urine, the best thing is to contact your nearest friendly urologist. This is a hardcore urology problem, and with no malice to a gynecologist or an obstetrician gynecologist, a lot of women feel that it's because something related to gynae and they end up with gynecologists. I'm not trying to say do not visit your gynecologist. They are very important. But yeah, this is an hardcore urology problem. So in case you have these problems, if you could manage with those lifestyle changes which I just mentioned, and if it's not working out for you that way, meet your nearest friendly urologist.
And even if the ladies go to the gynecologist, I'm sure they'll also ask them to go and consult a good urologist.
They will. Yeah.
Yes.
It is like you expect. No one would expect a urologist to be a good gynecologist. So similarly, a gynecologist can't be a urologist. So we are all focused on our areas. So, and it's again more women are probably shy and they feel more comfortable going to the gynecologist because that area is in close proximity to the area which a gynecologist deals with. So they feel that's more of a cultural thing that they go there.
Exactly, but it's important to understand, viewers, that we are talking about overactive bladder, and when we are talking about bladder, you need to consult a urologist if you have some issues, associated with bladder, or you have any urinary, etc. kind of, that trouble.
Okay.
Doctor, one more thing: whatever symptoms you have stated for OAB, we also associate these symptoms with diabetes. We also associate these symptoms with aging. So, have you came across people or patients who have, not visited you just because they have associated that this is aging issue? It's going to be with
Yeah,
me now.
I had
It's going
mentioned
to be
that.
like that only.
Yeah, correct. I had mentioned to you that OAB is got a lot of neurogenic element in its why those symptoms occur.
Yes.
And as I had mentioned, either when it's a young, the nerves have not yet matured, and at the other end, demyelination. Like you see electrical wires, there'll be a copper wire in between, and there's a plastic coating all around it, which insulates the wire. So myelin is again a fatty material around the nerves. So if with wear and tear that layer gets demyelinized, so it's exposing the central core, the wire. So if wires are exposed like that, there will be a short circuit. Similarly, when these nerves also get demyelinated, these nerves get irritated, and aging is a process. All our body organs have their wear and tear. Nerves also have their wear and tear. Bladder also have their wear and tear. So aging does have, and a young child's, a newborn child's bladder and a very elderly person's bladder is very similar. A newborn child, whether the child is in a lab, is wearing a nappy or is wearing clothes, the bladder fills and the child empties the bladder. Similarly, a very elderly gentleman also lose control of the bladder. So OAB is almost inevitable part of seriously elderly people. And in some, it hits them much earlier than they are seriously elderly. But yes, elderly people would end up having OAB symptoms in a vast majority of them.
Right. So the
And diabetes, of course, a poorly controlled diabetes will anyway increase the number of times the person has to go. So, as I was mentioning, once we have symptoms of OAB, we have to look for any secondary factor. So, diabetes is also one of the secondary factors we have to look for in a patient having increased frequency.
Right. So the bottom line is that in case you have any problem with urinary or incontinence problems, please go and seek advice from a good urologist. We have few questions from our viewers as well, doctor. We have Sarita Ghamal asking, how do I find out if I have urinary incontinence problem?
I mean, she doesn't have to find it out. She will have a wet underclothes. She will be soiling herself, and she will know that she is not dry. So, incontinence means that she is leaking urine involuntarily. So, involuntary leakage of urine means that when she is not supposed to be wet at work, while walking, or doing gymming, or cooking, or whatever she's in any other activity, she finds that her clothes are soiled. That means she's got incontinence.
Right. We have Shubham Maran asking, what new OAB treatments are being developed, and are there clinical trials I could participate in?
Well, these trials are drugs, and development of treatments is an ongoing process. They are always there. Currently, we have got good drugs available which treat a vast majority of patients. In case the person who asked this question has not responded to drugs and to other biofeedback mechanism, there is a posterior tibial stimulation therapy, there is a biofeedback mechanism, certain exercises that if they are not being done, then probably they can, and if they are able to visit a setup where a trial is being done, maybe they can be taken up, but provided they have not responded to the early of the simpler treatment. So in case he has already responded to a simpler treatment, there's no need to go and register himself for an ongoing trial. So these trials would occur in usually academic institutes where they have the wherewithal to do these trials, and then they recruit patients who have they have got set criteria where, so it is not random that I have a OAB problem, I need to join a trial. So any trial is done with an end, with a starting point and an end point. So the person who are enrolled have to fit in at that within that criteria which has been set for the trial.
I completely understand what you are saying, doctor, and I'm sure, Shubham, you have got your answer. Gitika Sharma is here asking, though we have already, talked about it, but still, her question is, are there foods or beverages I should avoid to keep from making my OAB worse?
Alcohol, I will just repeat, alcohol, all alcoholic drinks, do no differentiation between the vodkas and the beers and the whiskeys. Tea, coffee, chocolate, orange, lemon, pineapple, tomatoes, and spicy food. And among what can she have? Bananas, apples are good for OAB patients. Lettuce is good. Celery is good.
Okay. That's good. Abhishek Mishra had the same, question which you just answered, that what drinks are good for incontinence. And sir, is lemon water good for your bladder?
Lemon is not good per se for OAB. Lemon is an acidic juice like orange and pineapple, and is for someone who has got OAB symptoms, is not a good idea to have lemon juice. Who have got a stone problem, advise a lot of lemon for them because it got citrate, which is inhibitor of stone formation. But yeah, for OAB, lemon is not a great idea.
Okay, we have so many other viewers pouring their questions. We have with us Adi Jan asking, so one more, does holding your pee make your bladder stronger?
Not really. Not really. Actually, if someone, anything which is done against nature will never be a good thing to do. So, and in a given situation, someone stuck up in a meeting or stuck up in some traffic jam, and you have to hold on to your bladder. It's an unfortunate scenario where you have to just hold on. But otherwise, trying to hold on a bladder for no rhyme or reason makes no sense. It will produce over a period of time, it will increase the bladder size, and the bladder, which is normally the size of a melon, will become the size of a watermelon. And once the bladder becomes very large, it loses its power to contract. And there's a condition known as a lazy bladder syndrome, which occur in people who delay because of maybe their lifestyle or lack of a toilet. They don't pass urine for hours at a stretch, and they have very large bladders. And when the bladders become very large, they are unable to empty their bladder. So it's not a good idea to hold on to your bladder. In no way it makes the bladder stronger. It actually makes it weaker.
Okay. And we have Anu Singh asking, what vitamin helps with bladder control?
Sorry, I couldn't get it.
What vitamin helps with bladder control?
Per se, there is no particular vitamin which is related to bladder function. So, I mean, all the vitamins are part of our general health well-being, and for a good bladder function, we have to be, as we had just mentioned earlier, be healthy, keep an appropriate body weight, be physically active, eat normally, eat just about everything. And so vitamins are part of our nutrition. So that's about it. So all vitamins contribute to our well-being and health, and no specific vitamin is required for bladder well-being.
Okay. We have Alisa Mukherjee asking, what happens if incontinence is left untreated?
Incontinence left untreated, first of all, will be a major psychological blow to the individual. The individual will become a recluse, will become an introvert, will not participate in any social activity, will not step out of the house, and that all these will have a severe psychological impact on the individual, and they would not be contributing to society at all, and they will be a problem in their brain, and they've got all kinds of psychosomatic disorders will develop. So that's one problem on the psychological point of view. Other than that, with leakage occurring all the time, their skin will get excoriated. They will keep smelling of urine. So people around them, even the family members, would not like to spend time with them, sit with them, talk with them. And obviously, there is hygiene issues, and the skin is not accustomed to having urine touch it. So if urine is in regular contact with the skin gets excoriated, there becomes wounds. So there's a lot of issues, both physical and psychological, which would occur in a patient who has got incontinence.
Right. So in case you are going through any of the symptoms, please don't waste time. Go and consult your urologist.
Right.
That's really important. Before it gets worse, please go and consult your doctor. We have Ravina Patel asking, how quickly do the medication affect?
Well, we have got drugs which are pretty effective, and initially we do try to titrate the dose. So our idea is not to get you all right within, say, by the end of the day, but to basically get your symptoms under control, as well not give you side effects. So we kind of titrate the dose, and a typical patient should reach their end point by around 4 weeks, but this bulk of the relief is available within, say, 48 to 96 hours. So they would have significant relief within 2 to 4 days, but uh, the kind which whatever dose they are getting at 28 days, they'll be more or less where that dose will work for them. Whether that dose has to be increased or reduced depending on the side effects or the positive effects is a matter of concern depending on the response. But the typical full effect would be there by about 4 weeks, but most of it will be there within 4 days.
Fair enough. And Dr. Vyapi is asking a similar question. Can urinary incontinence be cured completely?
Yes, most of them can be cured. Most of them can be cured. Very few urinary, again, as I said, urinary incontinence, multiple OAB is not the only reason. Stress, overflow. So it depends what is the basic reason of your incontinence. And if that basic factor can be dealt with, yes, incontinence in almost all cases can be taken care of. And the patient can remain dry with either medication or certain physical methods or certain catheterizations. So almost everyone will remain dry.
Oh, that's really good. We have Chandan Iyer, doctor. He is asking what side effects might the medication cause and what can I do to help manage them?
Well, most of these drugs that I mentioned upfront would have certain degree of side effects, and we have to balance the side effects with the positive effects. The most common side effects are having a dry mouth, having constipation. So these are and some blurring of your vision. So these are drugs which are very common. So amongst these drugs, different sets of drugs have a different degree of side effects. So certain drugs are more potent in their effects as well as side effects. So we have to titrate the dose and the salt that we use. But dry mouth, constipation, blurred vision are the most common condition. And there is another drug which can give rise to, especially an untreated patient with hypertension, can give rise to accelerated hypertension. So if a person has got increased blood pressure or hypertension, has to be careful with the medication also.
Okay. We have Hemlata Mehta asking, are there other lifestyle steps I can take to help manage my OAB? Though we have already spoke about it, but still,
the
doctor,
5 or 6
anything that
things
you
which
would
I
like to?
mentioned, they are the ones which, one thing which I think I've not mentioned so far is to take care of if someone is constipated, make sure that the constipation is taken care of. Apart from that, weight loss and physical life and the dietary changes, fluid intake, also avoid constipation. And if it is there, get it treated.
Okay, does constipation has any direct correlation with OAB?
Yes, of course. Someone who is constipated will have much worse symptoms than a person who isn't constipated.
Okay. And what are the common mistakes that people do when they see these symptoms and when they, by the time they end up coming to you, you realize that they should have, came early or something? Any mistakes commonly done by the patients?
The most common thing which people do whenever they have a urinary problem, they will drink more fluid. So when they drink lots of fluid, if someone was going to pass urine 20 times a day, they end up passing urine 40 times a day. So they become much worse. So the commonest mistake people do is to drink more and more and more of fluids. And again, they will use a lot of these juices. And again, it's again a cultural heritage in India. Rather than having the entire fruit, people try to drink just the juice. So they would miss out all on the fiber, which is important for them. They will take only the flavor and the sugar and the acidic component. And orange juice and pineapple juices are again very popular idea. So these are these lifestyle changes which I mentioned, which make these things worse. Other than that, I think there's nothing much they can do themselves to make their symptoms worse, unless they've got a secondary disease like a stone tumor, which might get worse over a period of time.
Okay, and do they need to continue the course of the treatment, or if they get relief in 2 or 3 days, they can just stop the treatment?
Again, it depends on the cause of the OAB, and again, there is no well-defined duration where how long the patient will have to take medication. So it is like the response of the patient, how well she is doing, and how then we gradually taper off the dose and try to get the patient off drugs only on lifestyle management. So there is no well-defined. Suppose some patient has got an infection or a stone. So for them, as soon as the stone infection is taken care of, the OAB symptoms go away. But for a per se where their nerve supply is damaged or their OAB, so it is a very long-term treatment they need to take. And because of the long-term treatment of OAB drugs, there is a pretty significant dropout rate. People, because either of economic reasons where they find not buying the drug regularly, or they feel, oh, this drug, I take it, it works for one day, then it doesn't work. So, which is true. I mean, if I've got hypertension, diabetes, I have to take a drug every day. So similarly, if I've got OAB and my drug is working for me, so might as well take it every day and have a good productive life rather than suffer from it. So there is no well-defined duration of treatment. It depends on on the response the patient has, and my idea would be to get them down to the least possible dose or no dose and manage them with lifestyle changes once they are much better off.
Right. Whenever we talk about urinary or issues related to urinary, we know that our kidneys, our bladder, for men, the prostate is also anyways affecting because it's on the way. Does OAB affect any other organ related to the urinary functioning?
Yeah, if a person has got significant OAB, especially, and that person is not leaking urine. See, leaking urine is kind of an outlet. Consider bladder as a sphere, and the sphere contracts. As it contracts, it increases the pressure within that sphere. So if it leaks, it is like a release valve. Urine gets leaked out, the pressure gets reduced. Though the patient gets wet, there is a social embarrassment, soiling of clothes, but it saves the kidney. Now the same patient does not leak urine. So what happens? That very pressure is transmitted to the kidneys. So when it gets transmitted to these kidneys, a patient with OAB can have problems in his kidneys. The kidneys get dilated because of back pressure. There'll be holdup of urine. And if it is continuous for a significant length of time, can even cause renal impairment or drop in renal function. So OAB can affect the kidneys as well.
And how serious can OAB become, if we are not, if keep on ignoring the symptoms, etc.?
OAB, especially a wet OAB, is a cause of social embarrassment. A dry OAB it makes very difficult. People just don't step out of the house because they won't go to a market because they know if I go to the market, where would I pee? So they become recluse and they actually destroy their quality of life. So rather than even even if they're not damaging their kidneys or not causing any further problems, they're damaging their lives. They are losing out on what they are supposed to do on an everyday basis, whether it's work, home, whatever. They are decimating their lives. So might as well get treated, and most of them get treated so simply. So get back your life.
Right. So again, we are continuously repeating the same thing, but it's important that if you see any of these symptoms, please go and check with your urologist before it's too late. So please go, and you'll definitely get an early relief. Doctor, we are getting a lot of questions related to lemon water. People have this notion, as you were just mentioning, that we have this culture of consuming a lot of juices, orange or pineapple or lemon juice in the form of juice rather than eating the raw fruit. So people are continuously asking questions regarding lemon water because they have this notion in their head that lemon water is good for health. So lemon water should be good for the bladder. Plus, as you also mentioned that, they are saying that excessive water should be good for kidney and bladder as well. So in case of overactive bladder, can we consume more water?
So these are both myths, actually. Lemon, as is true of all citrus fruits, produce a acidic juice. And acidic juice is not suitable for OAB. Here I'm talking specifically of OAB. In OAB, lemon juice is not to be had. In OAB, excess fluid is not to be had. The concept of lemon juice being, a lot of people use lemon juice, especially in warm water, for losing weight. Whether it works or not, no comments. I would not believe in it, but a lot of people do that. And what happens over a period of time, you get used to having it. Unless you have it, you don't feel right. But in OAB per se, lemon juice is not to be had. Again, the concept that a lot of fluid is like flushing my kidneys. I don't have to, it's not a WC where I have to keep flushing the kidney over and over again. A kidney expels the metabolites which are produced by our regular metabolism, so that the minimum urine volume that we require is about 400 to about 800 ml of urine. We are able to expel all the metabolites that we have. So as we increase our fluid intake, our urinary volumes will increase, but the metabolites remain the same. So to what can be expelled in 800 ml of urine, I need not pass 8 liters of urine to expel the same amount of urine. Some amount of water, especially we are in a hot, humid country, we sweat a lot, and especially the last 1 month has been so hot. We require water. We don't need to get dehydrated. That's acceptable. But just to keep flushing our kidneys makes no sense. And if I'm drinking a lot of water, I'm in a hot environment. Suppose I'm sitting in an AC environment all day, and I'm not physically active, and I keep drinking a lot of water, I'll be passing urine very frequently. Compare it to a laborer who's out in the sun plowing his field. He will take liters and liters of water, even then will not produce any urine because he has lost most of it through his sweat. So the water intake is related to our lifestyle, the environment that we are in. There can be no fix that I have to take 4 liters or 6 liters or 2 liters. It depends totally on my lifestyle, in what environment I'm doing, what kind of physically activity I'm doing. So these are relative figures. We can't have a figure that drink a lot of fluid, keep flushing your kidneys, and that's good for you. Not at all.
Don't, don't make it a constitution that, okay, 6 liters is good for me. No, what is good for me?
You are in Missouri today, you don't require 6 liters. You are in Rajasthan, you will require 16 liters probably. So it depends where you are.
Exactly.
Yeah.
Exactly. So it depends upon your lifestyle, your work condition, where you are, etc., etc. So don't go by any, set parameter that, okay, 4 liter or 6 liters is good for me. It depends on individual. We have one more question, doctor, by Kamla Rai asking, I'm facing issues of overactive bladder. My bladder is unable to hold urine, and after drinking water, I get urge to urinate and unable to hold it for longer time. Please suggest.
I mean, she has got symptoms of OAB. She needs to consult a urologist who will evaluate any secondary cause of her OAB. If there is none, then she has to get on with medications. The medications will have to be changed, shifted if she's not getting adequate response. And even then, if the end of, say, a good trial of 2 or 3 months with using different combination of drugs, she is not getting adequate relief, then there are certain things where we can inject drugs into a bladder to paralyze the muscles so that she doesn't leak urine. There are certain stimulation of certain nerves in the leg which have a counterproductive effect on the bladder. So these are effects, things which can be done. So these are all done stepwise. You can't jump to injection in the bladder, which is a botulinum toxin which is injected in the bladder. So you can't jump to botulinum toxin without taking the drugs and doing the lifestyle changes. So it's all stepwise. One step, you climb the first stair, then you move to the second stairs, and then the third stair. I can't jump to the 10th stair on day one. So she has to consult a urologist and has to go in a stepwise manner to get rid of her symptoms. And wherever whatever works for her, that's it. She doesn't need to move further on.
Right. So Kamala, please go. If you have not yet seen a urologist, please go and meet your urologist. That's important. We have Sonia Iyer, doctor. Sonia is 25 years of age, saying, I have frequent urination up to 16 to 17 times during the day and 2 times during night since 2 months. I'm using Rolaton 2 mg. Every thing become normal after that. Is it curable, or I have to take medicine for lifelong?
Well, first of all, she has to make sure that she's not drinking too much fluids. So she has to make sure of her lifestyle changes, make sure of her dietary changes, whatever we have suggested. Make sure she's taking care of those dietary changes. She's not overdoing with the fluid as the previous question, a couple of questions earlier someone had raised. And also make sure that she's not constipated, and also that she's not overweight. So make sure that her weight is in check, she's physically active, and her dietary and the fluid requirements are done. She used a brand name, and okay, but what drug she's taking is fine. That is a good drug is one of the drug options available. And if it is working for her, great for her, but make sure that the other things are taken care of. She can take it for a couple of months, then reduce the dose, see how she does, and take it up from there. But as long as the drug is working for her and the dose he mentioned is not very high, and this drug does not have too many side effects, so it should work for her. But make sure that she's not doing she's taking care of the lifestyle changes. Make sure of her weight.
So that's important too. Right. So I'm sure Sonia, you has your answer. Please go and check, whatever doctor has just mentioned, and stay healthy. Take care of yourself, doctor. As we are at the concluding part of this session, what takeaway note that you would like to share with our viewers?
I would probably repeat myself. What I would say, try to live life in a very, it's very easy to say a healthy lifestyle, but what does a healthy lifestyle means? Spend at least half an hour to an hour doing some kind of physical activity, depending which is commensurate with your age and general build. And so be physically active, have a balanced diet, don't overdo anything. Even too much of a good thing is bad. So, and certain amount of bad things can be taken at times. So we are not here to prove ourselves as to be the best human being on this earth. So, but have a balanced diet. It's not as if I can't take a little liberties with my diet. Occasional liberties are acceptable. Keep your weight in check. And yes, have regular health checkups done, especially if you are 35, 40 plus. And even for the younger people, avoid, I'm certain firms will not be happy with me, but avoid all these fizzy drinks, fast food. All these fancy restaurants are very tempting, but keep them for some special occasions. Don't make it a habit going there, and keep off junk food, keep off, try to reduce alcoholic intake as much as you can, and similarly with the beverages also. So lead a healthy lifestyle, be physically active, keep weight in check, and pray to God. So that would take care of just about everything.
Right, a little bit of cheat,
And yes, yeah, spiritual
stay
well-being
healthy,
is
eat
also very
healthy.
important to try to be happy with. I mean, each one will desire the moon, but yes, not everyone, not, I mean, no one will get the moon. So be happy. I mean, the crux of living well is being happy with whatever you have. And see, there'll be thousands and thousands and millions who are much worse off than us, wherever we are, whatever stage of life we are. So be thankful to whatever we have and make the best of what we have.
Thank you so very much, Doctor. You have so well explained the whole, theory behind OAB, and also how important it is to stay healthy, stay happy, stay content. Thank you so very much, Dr. Elhence, for your valuable time, sir. And it has been quite an informative session for our viewers as well. We really look forward for many more such sessions in coming times. Thank you so very
Thank
much
you.
once
Thank you
again.
so much. And thank you for being a very fantastic host tonight.
Thank
Thank you.
you.
Bye-bye.
I'll take it as a great compliment. Thank you so very much. And viewers, thank you so very much for your excellent participation. And for more information on how to diagnose, manage, and treat overactive bladder, please stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Insta. Thank you. Good day to all of you.
Thank you. Bye-bye.